Thank you so much, chairpersons, to invite me on the stage. Thank you so much, Manoj sir and Purvi ma'am and Banshi sir to invite me for this prestigious conference. I congratulations for all the organizers to have this wonderful conference. Now, we know technology is improving our lives day in, day out, but there is a second side of the coin, right? So I'll be discussing something which is probably least discussed in most of the conferences nowadays, right? I'm Dr. Mudit Sabharwal, and I'm talking about CGM fatigue. Is it really possible, and how can we avoid that? So it's something to continued to what Dr. Amit had left us in his last presentation. Now, the agenda for my today's presentation would include understanding CGM itself and the fatigue which is caused by using CGM on multiple times, defining the phenomena and its clinical implications, and identifying at-risk patients, recognizing the early signs and how can we prevent those early signs with some strategies, intervention and support which we can do to prevent and to probably support our patients, and what are the future directions of innovation and evolving on CGM trends itself. Now, what is continuous glucose monitoring? We talk about CGM in probably every conference throughout the world nowadays. Now, that's basically it consists of three major components. One is real-time glucose data, where CGM provides continuous real-time blood glucose readings on the go within a few minutes, majorly between 5 to 15 minutes. There's a sensor and a transmitter. It can be a device or it is integrated in your mobile itself through an app. The sensor is applied on the skin and is paired by a transmitter wirelessly. And integration with various devices, including the insulin pumps, smartphones, and cloud portals, can be achieved using the nowadays CGMs. Now, there are various benefits with these CGMs. So, of course, there is improved glycemic control, where CGM use improves HbA1cs, prevents hypo and hyperglycemic hypo and hyperglycemic trends by reducing the glycemic variability patterns itself. Then there is trend analysis, which we achieve with CGM, where real-time trends and alerts provide preemptive interventions and tighter blood glucose control, which we can achieve through that. Of course, that leads to better quality of life. And of course, because of the same reason, there is a rapid intake of CGM, not only in type 1 patients, but in type 2 diabetes, gestational diabetes, and other chronic metabolic disorders also. But beyond these benefits, what are the emotional and cognitive costs to the patient and to the doctor, which we achieve, which we get? Now, what is exactly CGM fatigue? Now, CGM fatigue is a complex, multifaceted phenomena observed in individuals who are using continuous glucose monitoring devices, which is characterized by diminished motivation, again, diminished motivation and gradual disengagement of the patient from the device and its data, which leads to suboptimal adherence and reduced clinical benefits from the whole therapy itself. Now, it consists of four major problems. One is there is data overload because of the perceived burden which the patient gets from the device and its data. Then there is emotional exhaustion from the constant tracking. There is alarm frustration because nowadays we are getting sensors like Libre 2 Plus and some other companies who are providing alarms when there is hypo and hyper trends. But the problem, there are various problems which I'll be discussing in the coming slides. And then there is device tethering and loss of autonomy from the patient itself. Now, there are certain predisposing factors in at-risk populations for CGM fatigue. The characteristics generally include the newly diagnosed type 2 diabetes or type 1 diabetes patients, high psychological stress which the patient is suffering from by the diabetes itself, lower health literacy, complex regimes, and the history of burnout from using these devices. Then there is device-related issues where there are frequent alarms, discomfort, connectivity problems, which is very common nowadays, which we are getting, and probably we don't have that great connectivity in our country. Data presentation, which becomes overwhelming for the patients overall. And then there is clinical support gaps from both because of insufficient patient awareness, insufficient education, lack of personalized data interpretation, and lack of access to timely support which the patient requires. Now, of course, identifying these problems can actually drive proactive management of the CGM fatigue. Now, talking about alarm fatigue, it's basically it caused three major problems. One is desensitizing and overwhelming of the patient itself because of constant non-critical alarms that leads to attentional habituation, making the users ignore or disable alarms generally. And that, of course, creates cognitive behavioral problems and anxiety. Then the discontinuation of the data itself because of the same connectivity issues, where the deluge of data can be overwhelming, leading to disengagement and perceived lack of actionable insights. And of course, because of the same reason, patient may just stop sharing the data with the doctor itself. And then there is emotional and behavioral impact, where evidence suggests that increased stress, frustration, and burnout among the users experiencing alarm fatigue negatively impact their adherence and glucose control overall. Now, talking about the data overload and the psychological burnout, because there's so much of data which the patient is perceiving from the sensors itself, it becomes sometimes end up having burning out. Now, there is hypervigilance, where constant glucose data fosters obsessive monitoring and fear of fluctuations. So people keep on scanning the sensors, or they just keep on checking their sensors every 10 minutes, saying how is the glucose actually leveling out. Then there is cognitive fatigue. Because of the same reason, it leads to cognitive fatigue, which is the mental effort of interpreting and acting on frequent blood glucose fluctuations. And of course, that ultimately leads to emotional toll, which creates guilt, frustration, and anxiety that arise from failure of maintaining the perfect glucose trends, which was expected out of them. That ultimately also leads to adherence drop-off and behavioral fatigue, which is but obvious, which is basically derived by four major factors. One is the cognitive overload, that is, the constant data interpretation leads to mental exhaustion. Then there is emotional burden of not able to achieve the perfect trends. There is loss of novelty of the device that slowly fades off and ultimately leads to the novelty loss overall. Then there is perceived ineffectiveness, where lack of tangible health improvements are achieved from they ultimately lead to lack of tangible health improvements or actionable insights that ultimately reduces the motivation of the patient to use the sensors. And then, of course, lifestyle intervention, where lifestyle interference, which is derived from the device presence, social stigma, and restrictions that interfere with the quality of life. I mean, it's like simple sensors on the arm, and probably many females are not very comfortable wearing the sensors because they have to wear sari or etc. Now, there are certain evidences which prove the point. There are three major studies which I'll just mention briefly. One was a real-world adherence study, which was basically done with the CGM sensors using about 8,500 patients, which were done by Smith et al. In 2022, which was where the users discontinued using the sensors after 1 year itself, and this was the wear time was firstly 6 months, and then it kept on reducing over the next 1 year. The second one was on the psychological impact, which was a qualitative study involving 50 individuals that reported themes of anxiety, frustration, and feeling of tetheredness to the device, which directly related to the alarm load and the data interpretation demands from the device itself. And the third one was basically alarm optimization trial, where this was about 300 subjects, who demonstrated that personalized tiered alarm settings significantly reduced alarm fatigue and improved patient satisfaction without compromising glycemic outcomes. So the first two were done to actually prove the point about alarm and the tenderness fatigue, and then the second one was how to improve that. Now, there are certain proactive prevention strategies which we as doctors can take to probably reduce this CGM fatigue. The first is the personalized education, where tailored CGM training to the individual needs has to be done with the patients, which focuses on why and how data translates to action, because that is ultimately what we require from that data. Then the goal setting and focus, and this is something which we also lose going forward, where we help the patients to set realistic goals emphasizing on actionable patterns and not just individual glucose numbers, because glucose numbers are not the main focus here. These are the trends which are more important. And of course, simplifying this data review. I mean, of course, there are graphs and there are numbers, but then ultimately we have to simplify this for our patients. So again, teaching the patients to review the key metrics, not just total numbers, but then time in range. As Jyotidev sir was mentioning about time in range, that is which we are more interested about. Then there is alarm management, where we can optimize alarm settings to avoid alarm fatigue, empowering the patient to customize that alarms according to their lifestyle and according to their glucose management which we require from. And the fifth one was psychological support, which is very, very, very important for our patients, where we integrate mental health screening, connecting patients with the group supports or therapists who are available to actually support the patients. These may be groups, these may be social media groups or something like that. And of course, or just our diabetes educators itself. There are certain simple interventions which we can actually integrate in our clinical practice to prevent CGM fatigue. One is empathetic listening, and this is something which is a part of all support talks throughout the world, where we acknowledge and validate the patient's feelings and understand their specific frustrations for the data which we are perceiving. Second is re-evaluating and adjusting the CGM and settings according to what we require from that. So review the CGM settings, alarm thresholds, and reporting frequency. Consider CGM holidays, right? So this is something which is a term recently coined out. CGM holidays, where the patient is off CGM for some time, and then of course you can use it at specific frequencies. Then of course, refocus on data use, where you encourage reviewing 7 to 14 day data trend and not just numbers, which is where numbers are not really important for us when you are reviewing the data from that. And then reinforcing that support where a frequency of check-ins and involving caregivers can be helpful. Of course, there is a major role of digital health AI over here. So AI, so I'll just mention four major sections over here. So one is of course AI-powered insights, where automating the pattern recognition reduces the manual data and interpretation and the analysis of the burden of the analysis. Predicting analytics, where forecasting glucose trends, allowing proactive intervention rather than reactive responses, really creates a difference. Gamification of the data, where introducing elements of play and reward to enhance engagement and motivation can be used. And then of course telehealth integration, where Dr. Jyotidev, me and many others are actually using this, where we facilitate remote consultations for convenient, timely support and data review itself, and integrating and modifying our management strategies accordingly. Now, there are certain future directions and research needs for this. So, of course, smart alarms, where context-aware and predictive alarms can be used to minimize unnecessary alerts. Then there is integrated systems where, sorry, just 30 seconds, please. Seamless integration with insulin pumps, activity trackers, and EMRs with the CGMs. Patient-centric device, where involving patients in the development of future CGM interfaces and features, and then long-term outcomes, and not just focusing on long-term outcomes and not just pure data numbers in a shorter time period. So the key takeaways from my talk is that CGM fatigue is definitely real. It is a genuine patient concern that requires clinical attention. Then there is proactive prevention, which is the key, where identifying at-risk patients and implementing strategies to avoid CGM fatigue and control that can be helpful. Personalized support, where tailored education and ongoing psychological support is completely crucial for most of our patients. And of course, embracing technology is the main strategy to follow in the future, in present and the future scenario, where leveraging digital tools to enhance engagement and simplifying data is the key to our diabetes management. Thank you.